pertama ialah kita hidupkan kembali, iaitu beberapa tindakan kita. Yang pertama, untuk kita memerangi Covid-19, ya, proses-proses di sebalik takbir ini yang penting. Yang untuk kita lihat bagaimana kita dapat kumpul maklumat menggunakan logistik hospital di Kementerian Kesihatan di Sungai 7 hospital di Kent untuk pesakit COVID. Pesakit bukan COVID telah kita pindahkan ke hospital kluster, iaitu hospital daerah dan sebagainya. Jadi yang inilah tindakan kita dalam kita melakukan pemindahan. Kita perolehan untuk mendapatkan lebih banyak ventilator. Mungkin kes akan menambah. Kalau kes menambah, kalau masuk ke hospital, dan hospital akan mungkin akan jadi sesak dengan pesakit yang benar. Tapi kita juga membina hospital sementara dalam tempoh dari pengalaman kita mengendalikan SARS, COVID, H1N1. Jadi pengalaman tersebut telah membantu untuk kita menambah baik kesiapsiagaan kita. Yang ketiga, kalau kita lihat juga ialah organisasi kita nak sedia ada, dan bagaimana baca buku ialah servant leadership. Itu yang pertama, kita berkhidmat dulu dari sistem kita, health system kita dan juga kepimpinan kita. Terima kasih.
So, Saudara Dina ni akan how Malaysia succeeded in containing this pandemic. Maybe also the role of
leadership is about making the right decisions, particularly in a crisis like a pandemic. One of the biggest challenges we face, not just in Malaysia, but I'll give you also the global perspective, taking the evidence and then making those very difficult decisions. At the end of the day, to be honest, whatever decision is made, there will be people who are unhappy. So I think what DG probably didn't elaborate further was, I was in Geneva when this happened, so we were in touch with WhatsApp and sharing, what we were hearing at the ratio, as well as what which point will we close our borders, at which point will we actually start varying and so on and so forth. So leadership is very key. Making a decision is very, very important. The second, of course, is that, where we have done well, is Asia generally has experienced several epidemics. If so, what KKM has been able to do under DG's leadership is lockdown, but I was on home quarantine. So working together with Prime Minister of the PG and others at PAC as well, that where I think we saw the need was just for the rakyat. If they have no money, no income, and there are other diseases, SUDs and all that need to be paid attention to. In my tenure, I made it very clear to the Prime Minister that we need to have some mechanism where the private sector, the civil society organizations can participate in a healthy way, that we can then ensure we don't leave many behind. Because there's a tendency when you look at it from a Putrajaya perspective or a state, just have to receive approach to things, and they can actually be witness and give that information back. No coordination mechanism. So thankfully, Yayasan Hasanah, gathered GLC, the government-led corporations, and then coordinated what the needs were, and actually supported. The Ministry of Health alone cannot deal with it. Because they can do things like surveillance, treatment. And so forth. But behavioral change must come from the people, because and also playing a role to ensure that we don't have another spike of cases as a result of society now taking a very easy view. Or there's been an informal survey done by my former organization, and when once the full results are out, I can share that. But in Asia alone, Malaysia has the lowest number of people who think COVID-19. Is dangerous. Basically, our people think it's not dangerous, and more than 75% of people outside
coordinated action in order to bring the private sector especially to contribute, and there needs to be coordination. Building capacity to express your thoughts and criticisms, and how did you handle this situation?
We are looking into the life and livelihood, and then we are have to look into the whole. We have a first wave initially on the 24th of January. We have our first case until 11. Of February, that the case 20 at all. We call it the calm before storm. Then comes case 20 and even Italy. So these are 5 countries that we have identified. Initially in the phase 1 of first wave, we do not feel the social disruption, the economic disruption, and I believe many Malaysians already bought tickets to go for cherry blossom in Japan and Korea, and we were told that 8,000 teachers already been given the approval to go to tour in these 5 countries. Therefore, our concern is if they go for the tour with the family, and then at least we are looking for 30,000 Malaysian returnees bringing back. That's one. Second is that we also been informed by our counterpart in Brunei on the 9th of gathered in Sri Petaling Mosque, of which 1,500 from overseas. And 14,500 locally. So, and they have, and sure it did. So public groups actually, when we went back, they have a KPI to actually attract 40 people a day to attend, to come to the mosque, and that's where the spread of this virus infection until 5 generations. So, and it continued to have 17 cluster and subcluster. So this to take a drastic measures, that is actually to have the border control and the MCO. And it's not easy for the enhance our public health intervention, case detection, contact tracing, and identify the cluster and isolate them in the hospital, and then Malaysian returnees must be quarantined. That is a must. These are the two things that helps us to contain the infection locally. So we have seen it costs us a lot health issues every day without fail, giving information. And this is important when we engage. Once we engage, we explain all the issues and challenges, and we make the public understand the situation better, then the fear will be less. This is important for us to move on and share information. And we have been challenged, and we have been questioned a lot of issues, but we explain based on facts, based on science, not based on fear, not based. Before that was every day we have an engagement. Uh, 5 o'clock, that's my role, and 2 p.m. will be our Datuk Sri Ismail Sabri addressing non-medical issues and challenges to the civil servant. The leadership trusts the civil servant, and because we work as a team, and there's actually a meeting every day without fail. And all the issues that we have, we argue, we fight, and then we come up with consensus. And why? Based on facts and data. You know, sometimes there's a proposal and first to implement it within a short period of time. So in the Ministry of Health, the structure is already in place because and we are giving the advice to the Prime Minister, and the Prime Minister listens. Sometimes there's questions, then we have to clear the air and based
Response and clear communication to the public, which leads to a coordinated challenge in coordinating the healthcare between public and private institutions.
well, when we look into this crisis, have engaged with the public, the ambassadors, our private sectors coming together, see how best we can work with each other. So I think the coordination started much earlier than that, and but certainly we can enhance it further. Looking back now, what should we do? Perhaps we should have a system in place whereby we can trigger the system straight away. We can improve looking into the next pandemic, probably we can improve in terms of investment in the system. Coordinating the public and the private. In the private sector, cross over to work in the public sector. So within a short period of time. So how do we mobilize people, not only in inter-ministry, but also from the private sector coming to the public sector.
In hindsight, it's always 2020, but I think that, as we look forward to, he was that public figure, the public face that built trust between government and the community. But moving forward, I think how could we better optimize, right? The utilization of private sector. There were a lot of private hospitals, clinics that were actually suffering because of COVID, because they didn't have enough patients and so forth. Whereas our government hospitals were burdened, were really overloaded. The nursing staff particularly were really, really stressed. I think we don't talk enough about nurses and paramedics. It's not just doctors. That overflow of patients can be, directed to private hospitals. How do we make sure that even university hospitals that were receiving cases would also be well equipped, that would also it has revealed some areas where we really need to relook at systems change. I think that is quite obvious. DG and I are working on a book together. But there's everyday people who are doing amazing things during this pandemic, and I think we have a lot to reveal and tell the story of how a nation came together, right? And what lessons to be learned. Position right now.
Yes, thank you. Tan Sri, I couldn't agree more, and I'm sure UKM will be very happy to publish this book, and we need to learn the lessons, but just taking up on the cue of how Malaysians came together. There's certainly many pandemic. So we look forward to this book. It's certainly the lessons that we can learn. So in both of your opinions, how could Malaysia do better?
Prepared you will always need to do more. But one thing for sure is that we can't let this go to waste, and that that it's a consequence of environment degradation, man's we have really done a lot of damage to ourselves. I'm a big fan of planetary health, right? This is a discipline that's coming up. My dream is to set up a Asia Pacific Planetary Health Center. Look at there's a lot of systematic investment in preparedness. It's easy to say, well, let's be prepared. It does cost money. If you want to set up systems like WIGI by civil society, in that case, how do you strengthen civil society to be able to play that role? How do you bring in the innovation, approaches? Because I think innovation is very, very key, right? Because if you look at Korea and other countries, the reason why they've been able to really address the pandemic quite well is because they've invested many, many years after SARS, after MERS-CoV in developing rapid tests, all sorts of science innovations, right? That had then I saw no one wearing a mask, not one single person the entire weekend. So that frightened the daylight out of me because they were in restaurants, they were in public places, but no one even bothered or cared about this. So this is symptomatic of what's actually going around in the country.
Maybe about 2%, 2.1%. So I think now is we need to realize that this health investment is important in the public health, with the administrator. You can just save a nation and avert a disaster. So this is why I think we need to invest in the system in terms of logistics, in terms of coordination, software, innovation, etc. And this must be crisis environment. So I think that system must be in place. Innovation, etc. Rather than reactive, then only we plan what to do. We already plan what to do, and then when the crisis comes, then we are prepared. So this is the anticipation of what needs to be done in time to come. So I hope that this
We have to place greater emphasis on public health in the medical curriculum. I remember as an undergraduate not enjoying my public health classes. So I think maybe even place more emphasis on public health. Make it real, right? Make it real in terms of learning from.
It helps us to predict where we are and where we will be before. And where are we going to face issues and challenges in time to come. So modeling in terms of statistics, then you're looking apps now. We are using technology apps. We're looking at, maybe have to focus in the public health. Be strong in public health, not only locally, but regionally and globally. And now we can see how important is public health. I'm a surgeon, but I think it's very important. But I use the concept of in surgery to strike that balance, not hyper and not hypo, but how can you maintain a situation, the life and livelihood. Every time you come to make a important for the public, and once they accept your logic, your but it can be done much better with the dashboard. For example, the public, I don't need to make the announcement. The public can access to the information online, etc. So these are some of the things that we can improve further in time to come.
Thank you for both your views. I couldn't agree more that this pandemic really highlighted interest amongst our students as well. Moving on to some of the questions that are coming in. This is for both of you. With this COVID-19 new normal, what other changes can we expect in our lives, our work, our economies, and our public policies? And what is our compass or our guide to get our country back on track?
Of the new normal, which doesn't exist. The second thing is, I think what we will have to expect and prepare for is that they have to rethink their strategies and, in fact, change what they might want to do, because this is this is what's going to happen for the next couple of years. Now, I say and that it becomes a public vaccine is another story. But until that point in time, and even when there is a vaccine, of very smart working women is the trying to balance family and so forth. And I think now we've shown that actually you can know that in many parts of Malaysia, we don't have the 4G or the internet access. So how on earth are we going to tell children to learn online when, number one, there's no Wi-Fi, and number two, there's only one device that they have to share with everybody else in the family. So these are the really I'm gonna say, the elephant put the elephant in the room, right? We are in a multiracial environment, and we need interactions with each other because, being in isolation is not healthy. To building, relationships among ourselves. So this, I think, we don't. And just as we think we found a solution, we find that the ability is going to be with us for some time. So, that will require a lot of thinking, a lot of
on the threat of anti-vaccine group spreading false news, not only about COVID-19, but influencing
use strategic communication and social media. Is very important. We are not only facing the virus, but we're also facing the viral of the social media. Who posted a fake news, we can take them, charge them to court as well. So I think we managed to nick the viral of the fake news, but more importantly, that we have this strategic communication platform. So in Ministry of Health, many of us are engaged in social media. So like me, I'm using Twitter, Facebook, Facebook to engage daily update of information, and I do it myself and assisted by my team giving me the information, but I upload it myself, because anything that before I had the bottom-up feedback. But I do not answer, but I listen to all the comments. I listen to what are the issues being discussed, and then tomorrow I'll discuss it in our press conference. Etc. I address that straight away, or I'll get evidence and facts to address it. For example, now the issue of why don't we make it compulsory to wear a mask? I think we are strongly, encourage people to put on a mask. But if it comes under a compulsory, mandatory to put on a mask under Act 342, so much so I become a professional reporter now, giving the latest information. And the mainstream media is taking information from our Facebook. Because this is the latest information. I don't need to address the reporter every now and then, but it's a continuous engagement with the public, explanation, issues and challenges. Manage the expectation, build trust, and once we have built trust, and then whatever we say. Because the action of social distancing, wearing a mask and frequent hand washing, these are three simple measures that we do. The public aware about this and then change their behavior. The most difficult change is to change the mind into reactive. Because of pandemic, we have to change? No. We need to teach public health measures and as well as hygiene from day one.
Yeah.
Not only during the pandemic crisis. This is where a healthy nation is actually a very important economic sector that you see, that if, for example, public, and hopefully, we can make a big difference in time to come.
I think that I think we've adopted and the laws. I mean, the standard operating procedures, because they are harming other people in the process, right? But on the question of anti card, right? But there's also rights of the public in terms of disease protection and so forth. And we've seen the impact of a disease like COVID-19. But worse than that, we're also seeing emergence of myths that then, tie with NKN. National Security Council is an important one. I think recently, and DG asked me to pop into an area in Qatar where there's been an outbreak of diphtheria. I've never heard of people getting diphtheria for the longest time. But this is again, groups that are isolated that don't want to get vaccinated and so forth.
Into it. So there is a question here, what important policy would you recommend to all sectors in Malaysia so that all sectors will bring along the health or the cleanliness aspects as part of their sectors to prevent pandemics in future?
In personal hygiene, etc. But now the issue is to empower the public, empower the community. Empower the family and individual to take care of themselves, their hygiene. Need to change because public health is about the public. It's not about the Ministry of Health, LRT, for example. Then the public can actually take action. And that's where we want the empowerment of the public and to do things, but to understand the situation and to do it rightly, not only from the policy aspect. Sometimes there's many policies that we have. Then I think there's a way forward. As far as the vaccine is concerned, today we do not have the vaccine yet. But what I'm trying to say is that while we research the vaccine, but if we were to take the public health measures like we did for and the preventive measures taken by the public. So in terms of compliance is important. Changing of the mindset. Important.
Is absolutely spot on, but we have two things I think we need to also focus on. If we empower the public that people not wearing their mask on their chin all the time, it's really keep themselves clean and so on and so forth. I said, and then of course in the education system as well, how do you bring the morals, hygiene, most vulnerable among us who may not be able to have the. It talks about how economists have really it akins economists to the cuckoo bird, right? That goes into a nest and kicks all the other birds out and then goes fatter and all that. So the whole link on why is it that we look only at a growing and fattening GDP as a measure of success. So I think we can look at countries like New Zealand now that are adopting very different models in looking at economic development. So I think it's time. If anything, I hope COVID has taught us to be more humble, more grateful.
After this, lessons learned from this pandemic, there's a question here which is a bit more of a personal nature. What are the motivations that drive both of you to stand strong
medicine, but because we want to serve. And because of that, so you must be sincere to yourself. That is what we want, comes from the heart. Difficult case, for example, you have no experience whatsoever. But the first is your intention. If your intention is right, this is the issues that we discuss clearly, and you get buy-in. And it's not from top-down, authoritative way of doing things. It is actually a collective because we listen to everyone. Everyone have everyone in our organization is important, leaving their views, doing their job, and then we collectively bring it. Bring it up as our guide the people together for a common goal that is actually to serve the people and to avert. And if everyone play their role, I'm sure sure that we can coordinate efforts. And as I said, it's an endless possibility. And that's why I think after having prepared, having planned, complacency, and complacency breeds failure. So there's a cycle back again. So now our fear is that whether we are able, this is the biggest challenge. The only way to do is changing the mindset, and then taking all the precautionary measures, public health measures, as well as maintaining
to do this. I don't think that, yes, it's, our Aman remembered for my wealth, which I don't really have, but, will it be remembered for the fact that I tried of the world?
Thank you. That's really certainly very thoughtful. Answers. We have a question that's come in.
It's just new, but it's already capturing I can give you some raw data. This, and sometimes some organizations are better left uncoordinated, particularly those who work within communities. Let them get on with it. We don't want to people have given. Now, one of the biggest aims of this is actually to support capacity development of civil society. Being a civil society actor means that you're independent, you're able to, it has to be based on principles. So those interested, reach out to me or go to match and then
Dato, do you have anything to say about the partnerships with the NGOs?
Well, I think it's a very important that we continue our partnership with the NGOs. For example, the major floods in 2014, and we realized that at that point of time, see, NGOs came in, and then, but we do not have a system then, you know, in terms of coordinating the NGOs. Then, you know, on the role of the NGOs, and then to coordinate. And today, for example, in the looking into our crisis in pandemic crisis, when we are short of looking in the gloves, we are the major manufacturing for the glove. The services that we have between the public and the private. So that's why we use this leadership is basically on the whole government and the whole society approach. And then we meet in halfway, and that's where we get the best of outcomes if we can actually utilize the coordinate the implementation in time to come.
Thank you. So we're coming to the last 5 minutes of our Q&A session, and probably we only have time to answer just one more. Sorry to the audience. There's still quite a number here.
Well, in Ministry of Health, we prepare for the worst and then we hope for the best. So we hope that by this pandemic, I think the resources that we have, optimize the resources, high impact, reasonable cost and good outcomes. That is our strategy.
Also involved in assisting other countries in the region, especially such as Indonesia, for example, in curbing the spread of COVID-19.
Regional committee meetings. So hopefully by doing so, the World Health Organization will be the one that advise the respective countries the do's and not, and the best practices. So I think we share the best practices to the World Health Organization, and they are the one that taking the 19, but the assistance comes from the World Health Organization.
If I may add to that, I think that at the ASEAN summit, and even before the ASEAN summit, the body for us, because we are in part of ASEAN. We are one of the founders, and there are 600 million people living in this. Recently, as well, with a group of friends, is how do we maybe hope to change IMR into an ASEAN CDC, right? To really take it one step higher. Leading on the pandemic, and this is because of the transparency and the trust approach. But this is critical. If you don't have that, you lose the engagement with the public, and it's not rocket science.
Buatan untuk menutup majlis kita pada hari ini.
Untuk negara kita dari segi leadership dan approaching to handle. The message daripada dua tokoh alumni kita, dan kita berbangga. We are very pleased. We are very honored. We are very proud, and every single house in kami ingin memberi token of appreciation here, ya, kepada dua-dua panel kita dan Datuk Visi juga yang telah hadir dalam bicara emas alumni, atau Datuk Naib Chancellor kita yang mana menceritakan cabaran, rintangan yang perit yang dihadapi oleh fakulti kita 48 years ago until we see the bond of two leaders sitting in front of us, managing the healthcare. Wabarakatuh dan salam sejahtera. Silakan seterusnya Encik Bukhari. Dan dua tokoh kita dan saya difahamkan lebih 1000 penonton pada pagi ini dan semoga semua di sana mendapat manfaat daripada bicara perdana pada kali ini. Sekian sahaja. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera.